Hi, my name is Deborah Crouch, and I would like to discuss some important studies related to the educational levels of nursing. Whether to require a Bachelorette of Science degree in nursing, that's known as your BSN, has been a concern for decades. Past research has shown there's a significant relationship between nursing education and the improvement of patient outcomes. It's also felt that BSNs would ensure higher quality of patient care, resulting in a lower mortality rate. Research suggests that a baccalaureate and graduate degree level prepared nurses are linked to a lower mortality rate and have positive outcomes. The two main points of that would be, one, the lower mortality rate, and the second would be the positive outcomes have improved. The first major point that is linked to the educational levels is lower mortality. It's associated with a higher percent of BSN staff. It is believed that critical decisions, solutions, and actions taken result in patient outcomes. Critical thinking is what enables a nurse to make good clinical judgments. This portion of my presentation represents one of the first studies published, and according to Dr. Linda Atkins and her colleagues, it was published in 2003 in the Journal of American Medical Association. Involved 168 hospitals in Pennsylvania, where they found with a 10% increase in the proportion of BSN nursing staff was associated with a 5% decrease in mortality rate. That was a patient dying within the first 30 days of admission or death from a serious complication once they were there. That's considered a failure to rescue. It also showed a positive line for outcomes. In the 2014 study that was led again by Dr. Atkins, it analyzed data from hospitals from 9 European countries. They were Belgium and England, Finland, Ireland, the Netherlands, Norway, Spain, Sweden, and Switzerland. They concluded for every 10% increase in the proportion of nurses with BS degrees reduced the likelihood of inpatients dying within the first 30 days of admission by 7%. In an August 2014 issue of the International Journal of Nursing Studies, another study was published by Chu and his research team that was from nursing schools in South Korea and some from the University of Pennsylvania. They reported that a 10% increase in the BSN nurses was associated with a 9% decrease in patient deaths in South Korean hospitals. The second major point was positive outcomes. They've been looking at this for the past 40 years of research, and studies have been done looking at the association between nursing education and the quality of care. Outcomes are considered the conditions at the end of the disease process or medical treatment. They are considered so important because they are indicators for the quality of care. According to Beijing and his colleagues, better patient outcomes are related to communication with patients and other care providers, and also the professional empowerment of the nurse. The studies they did were, they took data from 21 University Health System hospitals, and they analyzed the connection between patient outcomes and the educational level of the RNs. Their conclusion was that if those hospitals that had the higher percent of BSN nursing staff had a lower hospital-acquired pressure ulcers, the rate to the failure to rescue rate was much lower. Post-op deep vein thrombophlebitis and pulmonary embolus, and also the length of stay at the hospitals was shorter. In a study published in October 2014's issue of Medical Care by Dr. Yushina and his colleagues from the University of Michigan, their conclusion was by increasing the amount of care provided by BSNs to 80%, it would improve outcomes significantly by lowering the readmission rate and also having a shorter length of stay while they're there. So to conclude, research suggests that baccalaureate and graduate degree level prepared nurses are linked to lower mortality rates and have positive outcomes. So the two major points that are related are your lower mortality rates and your positive patient outcomes that are associated with the increase of the BSN. From the growing body of research and the studies I've discussed today, to make that change, to bring those mortality rates lower and to have more positive outcomes, nurses in today's workforce need to have the minimum of a BSN in nursing. According to Weinberg and his colleagues, he felt that BSN nurses are more professionally empowered. They advocate more for themselves and for their patient. They have more skills in critical thinking. They exercise clinical judgment much more than those nurses with less formal education. They felt that BSNs are better prepared to communicate with the providers and with the patients, and therefore contributes to better outcomes. So from the decades of research, the need to move nurses from the task-based proficiency to a higher level of competency of knowledge and decision-making skills. In October 2010, the Institute of Medicine released a landmark report called The Future of Nursing, Leading Changes, Advancing Health. It was an initiative by the Robert Wood Johnson Foundation. This group called for having an 80% bachelorette prepared RN workforce by the year of 2020. The expert committee that prepared this evidence-based recommendation in the report stated that to respond to the demands of the evolving healthcare system and to meet the changes that's needed by patients today, nurses must achieve a higher level of education. Thank you.